Proper tongue placement occurs when someone gently rests their tongue on the roof of their mouth just behind the teeth. The tongue resting in this position helps keep their palate wide and flat. All pacifiers are going to keep the tongue anchored down to the floor of the mouth and prevent the tongue from resting on the roof of the mouth, creating that wide, flat palate. So that raises the question, if you do want to use a pacifier, does it matter which one you choose, and what should you consider when selecting a pacifier? One big thing to consider is the shape of the pacifier. There are two main pacifier shapes you will see widely debated, and depending on what lens you're looking through, you could probably see the benefits of each. The first are cylindrical pacifiers, which are designed to promote lateral tongue cupping. So this is where the sides of the tongue wrap up around the edges of the pacifier. They also promote strengthening at the base or back of the tongue. Many feeding therapists find this to be the ideal shape for promoting the same oral motor skills needed to advance diet textures, drinking through a straw, and speech sound development. Many dentists argue overuse of the cylindrical pacifier can cause a malocclusion, such as an anterior open bite, where the front of the teeth don't align and kind of jut out. These observations have been confirmed in the research as well. Dentists tend to recommend what is known as an orthodontic pacifier. These pacifier shapes are narrower at the base where the front teeth erupt, have more of a flattened nipple to simulate what happens to mom's nipple while she's directly nursing, and promotes more contact between the tongue and palate, as well as a smooth transition and continuation of the hard palate with that upward angle design. Oral functional therapists and speech therapists tend to argue that these orthodontic pacifiers don't promote the other functional oral motor skills for eating and speech development, as we just discussed. So which do you choose? As a feeding therapist, part of my job is to assess the child as a whole and determine which pacifier size, shape, and texture is going to be the best fit in baby's mouth, and how I can use different pacifiers therapeutically to achieve the goals we're working on. This means I have used and will use different pacifiers depending on the needs of the individual child. Obviously, I can't do that type of individualized assessment for you all here, but I can share my favorite pacifier on the market right now and why. So the desired pacifier shape, in my opinion, is one that falls somewhere in between that cylindrical and orthodontic. I love these Boon JEWL pacifiers because they created a pacifier that fits really nicely in that middle ground space between cylindrical and orthodontic, which promotes a little bit of tongue cupping where the lateral edges or side of the tongue come up and around the pacifier, as well as strengthening at the base of the tongue. It also has this flare at the bottom that encourages free jaw movement and forward tongue movement to help keep the pacifier in the mouth, which is similar to the action a baby would be using while they're breastfeeding. And it also keeps our dental friends happy because it has a slightly flatter shape on the very top, but the sides are angled down, and I don't know, if I saw a pacifier that looked like this shape, I couldn't imagine a more beautiful thing. The other main thing to consider when selecting a pacifier is the size of the pacifier. If your baby's using a pacifier that doesn't fit the space in their mouth well, the inward pressure while sucking can cause the structures of their face to elongate. The American Academy of Pediatric Dentists recommends finding the correct size pacifier for your baby to provide adequate palatal support. This can be done using biometrics, which are the unique measurements of your baby's structure. And this has actually shown some promise in recent research. And there's an app I came across while I was preparing for this talk called Pacified, which was developed by a pediatric dentist and uses biometrics to make pacifier size recommendations. It's free, and all you have to do is enter your baby's data, including age, weight, sex, and race, and then take a photo of your baby straight on and the type of pacifier that you prefer to use, and the app has an algorithm which will compute a recommended pacifier size for your baby. So for example, I just did this with my son, and since we love using the Boon JEWL pacifier, it recommended stage 3 for him. It's important to take all of these things into account when selecting a pacifier size because babies are also variable in size. So the same 3-month pacifier in one brand may be much larger than a 3-month pacifier in a different brand. My final and possibly most important thoughts on this portion of the series before we go over some of the safety elements of pacifiers are, no matter which pacifier you you choose to use with your baby, you should pay attention to the frequency and duration you are using them for. Pacifiers can be really great tools to use for pacifying, soothing, suck training, and SIDS prevention, which means when we choose to use one, we should have a reason why we're using one. As I mentioned before, I don't recommend giving one to your baby just because, especially if they're happy and content. Now we'll quickly run through some additional pacifier safety guidelines. Pacifiers are required to have 2 ventilation holes. The AAP recommends that pacifiers are all one piece to avoid the potential for a 2-piece pacifier coming apart while baby is using it. Due to strangulation hazards, the United States Consumer Product Safety Commission does not allow for pacifiers to be sold with cords attached and actually requires pacifier companies to include a warning on their packaging not to attach cords. If you choose to use a pacifier clip, it's recommended they are no longer than necessary and shorter than 7 to 8 inches in total length. You also only want to tether the pacifier to baby's clothing and only when they're awake and monitored. You never want to lay your baby down with a pacifier clip attached. It is recommended to clean your pacifier daily and not to share pacifiers with other children, including siblings, or put baby's binky in your mouth to clean it. It's also recommended to inspect the pacifier for any signs of wear or tear or damage by doing a daily pull test prior to giving it to your baby. If damage or weakness is observed, discard immediately. And finally, you don't want to make a habit of dipping your binky in anything, as this can cause tooth decay. I hope after learning about the features of different pacifiers, you can look at pacifiers with a more critical eye to determine which style you would like to try with your baby and why. As I was preparing for this series, I was trying to think if there were any pacifiers on the market that I don't like. And as I mentioned earlier, there are general guidelines I follow to optimize oral growth and development, but I do use different pacifiers for different reasons based on my clinical assessment and the individual's needs. I have really been liking this Boon JEWL pacifier because it truly is one of a kind as far as shape goes, and it's kind of the best of both worlds in my opinion. And I truly can't reiterate enough how frequency and duration of pacifier use is of utmost importance, so use your pacifier sparingly. Now, possibly the moment you've all been waiting for in the final segment of this series, let's get into weaning from the pacifier.